The worst outcomes of this pandemic have been felt by those who have been least able to speak up, or at least likely to be heard and taken seriously. We have watched the real-time impact of ableism, ageism, racism, and other structures of oppression. But we have also had a glimpse of what's possible when those structures are challenged and when the barriers are broken down. One of the most powerful lessons I observed in a positive way was the protective influence of Indigenous ways of knowing and doing. Chief Don Maracle of the Tyendinaga Mohawks of the Bay of Quinte made smart public health decisions based on the wisdom of their culture right from the start. He made sure that elders were told to stay home. He arranged for meal deliveries and a system to check in on older people. He told me that the top priority of their culture was the protection of elders. What was the result? In a population of 5,000 people, there have been only 11 cases of COVID and only 1 death. Imagine if we had that kind of care of older people in the rest of our culture.
We need to switch our mode of thinking. We have a tendency in healthcare, and particularly in medicine, as Jane has mentioned, to kind of be paternalistic about things. And we really need to switch that and flip that on its head. We need to stop asking people, what's wrong with you, and ask people, what happened to you or what matters to you. We need to, stop looking at a deficits-based approach to care and start looking at people's strengths, and not like, where are you now? Where do you want to be tomorrow? Focus more on healing, not prescribing medicines. And I think it's a total paradigm shift towards community healing. And I truly think that the power lies in community. I mean, I work in hospital too, and I know hospitals are important, but I think there's a general, trend in this conversation is we need to invest in community, not just dollars and cents, but our resources, our time. And when I say invest in community, it means co-design with the very people who use our healthcare systems.
I myself have recently witnessed the sad exclusion of caregiver input in care due to hospital visitation restrictions with my grandmother. My nanny Scott is 84 years old and was completely independent. She went to emergency with dizziness and nausea. She had to be taken by family to other hospitals due to a lack of ambulances, where she was told she had cancer in her lungs, which spread to her brain, while she was completely alone, as no family members were allowed in. I must question where the humanity is in that. On the other side of my family tree during COVID, my nanny Hartman has gone from a stoic vodka drinking self-advocate to a very confused and frail woman in long-term care. I know that this rapid decline could have been tempered by family visitation and its evidence-based need for ongoing social stimulation for those with dementia. The PSW and nursing staff cannot do this work alone, and many long-term care residents like my nanny do not have the capacity to have independent virtual visitations with their loved ones. The results are incredibly sad personal disclosures of wanting to die because her quality of life is well below what she envisioned for her senior years. Caregivers are more than visitors.
Thank you to all the panelists. I think it's been really powerful. And I think we're hearing a lot about how to really achieve health equity, we have to redefine what healthcare is. And I think we heard a lot of great thoughts about how health is much more than just what happens in a doctor's office or in a hospital. It's about community, money, power, politics, partnerships, access, paternalism, and breaking down silos. So I'm looking forward to hearing more about this.